Some more strengthening for the back side of the hip, the glutes primarily. They tend to be weak in a lot of individuals. You're going to start lying down flat on the floor, your head is supported on pillows. Feet sort of shoulder hip width apart, your knees in line with your feet so your knees aren't rolled in. And in this position, you can do it either way. Some people like to get you to do a little posterior pelvic tilt and then lift up and come up as far as you're comfortable, keeping a good squeeze of your bum. Like really focus on squeezing your bum cheeks together in this position. You can either get in and tap with your bum to make sure that's happening, and then back down and up again and down. The lower abs again are engaged first to stabilize the spine. Your head is staying supported, so if you're feeling strain through your neck, you can, put a lower pillow or not use a pillow at all. Nice and slow up and down. We can then progress those, come back down, and get a little bit of the inner thigh, outer thigh working at the same time. These inner and outer thigh muscles primarily work as stabilizers of our hips as we're walking. So I'll get someone doing an isometric contraction, squeezing the ball hard as if you're trying to burst it, and then lifting your bum. Feel how that makes things a little bit more difficult? Okay, come all the way up and then all the way down. And if you want to take a little rest, just relax and then tighten again and up again. The more often that we are tightening and releasing, the more often we're having to tell our brain to contract the right muscle. So sometimes it's good to even just come all the way down, and even in between reps, and rest for just a split second and then tighten again, engage everything and come up again. Okay, we can do these as such. We can make it a little more difficult by decreasing your base of support, bringing your shoulders up, squeeze, come up and down and up and down. Another sort of compound, we're starting to get into our core, but we're still working our glutes and our stabilizers of our hips. You can squeeze the ball and bring yourself up. Keep squeezing and staying up. Now separate your knees against the resistance of the tubing and then back out. So again, we're getting into those posterior glutes. And again, resist out and then squeeze, and a few repetitions of that. Okay, as high as you can be, neck is supported. If you want to make that more difficult, arms across your chest, eyes closed. Alternately, we can add a sit fit, something that's unstable under the feet or under the shoulders to make this more aggressive, more difficult. Okay, now with your arms and come down for a sec, give yourself a rest. Hands down, we can squeeze, lift up. And you want to make this really hard. Try to keep your hips completely level, core is really strongly engaged, and try to straighten out a leg. Squeezing. Okay, and then back, other side. Keep the hips level. A little bit more advanced, sort of working glute, posterior sling, core strengthening work. And again, when that gets really hard, we lift one leg, we lift the opposite arm just a centimeter off the ground. Okay, and then back down. That's making you work hard. Good.